Hi, this is Dr. Walker again from Denwalker.com. I thought I'd talk a little about something that I really found out about this last couple of days. And this is what happens to some people, not all people, not all individuals, but happen to some people after they've had the vaccine. So in other words, there are symptoms that persist essentially after the vaccine. And again, I read this material sort of every day, and I did not realize this, and I thought I'd talk a little about it so that if you're feeling sort of this way, you're not isolated, you're not feeling alone. And this was really triggered by the fact that I was reading a case about a neurosurgeon and a nurse, in fact, that were having some symptoms that were, post-COVID vaccination that they felt they did not want to or feel comfortable talking about because they didn't want to be stigmatized, as many people are feeling. They don't want to feel as though they're being ostracized in any way. Anyway, as I said before, I read this material every day, and I did not realize that this is happening to some people. And again, I've not had the vaccine. I'm sort of just holding out for a while. Anyway, the typical thing that happens, and I think we all know about them, is after the vaccine, your first dose, whether it be Moderna or Pfizer, folks have this local reaction, pain, soreness in that site, and they may also have sort of a low-grade fever. They may have sort of joint pain, myalgias, muscle aches, and those kinds of things. And they typically, as far as I know, they typically resolve within 24 to 48 hours for the most part. And that's what I'm hearing. That's what I hear from folks that work for me as well. The second vaccine, though, the second dose, 3 or 4 weeks later, is sort of the response is the same in that people still discuss that soreness at the injection site. They talk about as well some myalgias, some neck pain, low-grade fever, that sort of stuff. The difference, though, with the second injection is that there are some people, again, this is not for or against the vaccine. There are some people, however, that discusses the fact that the neck pain, the headache, the low-grade fever, the joint pain, the muscle ache, they persist. And they persist 4, 5, 6 months after the fact. In fact, one of the ladies that worked for me, she mentioned that she had this sort of low-grade, if you would, sort of a low-grade headache that just never seems to go away. And she never had this issue before the vaccine, and so this is brand new for her. And so she talks about it every now and then. But again, I did not realize this is sort of more people are having it than I thought would have had it. More people are having it than I knew, and so I thought I'd discuss that. Now, it's not the typical, the drug companies will talk about some of their other big things, the myocarditis, the pericarditis, the Guillain-Barré, the DVT, the pulmonary, the PE, and I think some folks are they're discussing it now, they're mentioning it now, which again, they're essentially acknowledging the fact that can happen, but obviously, the incidence that people are sort of discussing it is way less than the manufacturers are saying it happened. So I don't know how true that is. I don't know, I can't dig much into that because some of the data, obviously, the VAERS system, the VAERS system, which is where people typically upload their symptoms post-vaccine, from my understanding, it's fraught with sort of errors and problems and those kind of things. So in other words, individuals who have problems, either do not report to their physician, it's not updated very well, and there's no discussion what happens, let's say 2 months or 3 months post-vaccination. Let's say you have a problem 2 months post-vaccination, is that associated with the vaccine or not? So there's lots of discussion about that piece, which is not quite clear yet. So anyway, as you know, I'm just trying to get this information out there, and so what I'm going to do, in fact, in the next couple of days, if you just bear with me and give me a couple of days, I'm trying to create a section on my website, denwalker.com, that sort of chronicles people's concerns post-vaccine. So in other words, what I'm trying to do is I'm trying to not have people feel so isolated because, again, I didn't know this is happening to some people, and so I'm thinking that maybe more people are having sort of this low-grade fever, the headache, the joint pain, the muscle ache, the fatigue, the chronic fatigue, the sometimes shortness of breath, perhaps low-grade chest pain, having all those things, but they're thinking that it's just them, it's just that individual. It's not that many people, and so you don't know what your neighbor is suffering from. You don't know the person down the road is suffering from, the person across town is suffering from. And again, I suspect, and again, I could be completely wrong, I suspect it's happening to more people than you know. So you're not isolated. So what I'm trying to do again on my site, and give me a couple of days, hopefully by Monday or so of next week, I should have a spot in there that you can go in and you can discuss what your personal sort of responses are post the vaccine, and so other people can actually see it as well and realize, for example, that the concern that they have, the disorder that they have post-vaccine, is not an isolated thing just to them or just for them. And in fact, maybe some folks aren't even attributing the miles that they have, the soreness that they have, the that brain fog. That's the other part I forgot to mention, that sort of a brain fog that is sort of perpetually there. So you don't think that this is just you, this is just something that happens post-vaccine. Again, I think it's happening to more people, more than we think, more than the drug companies think, more than it's reported in the VAERS system. And again, whether or not that is actually reported in the VAERS system, I don't know that piece. But anyway, I'd like to have a spot on the site that individuals can actually go in and say, oh my God, yes, I've had the brain fog, I've had the neck soreness, I've had the joint pain, I've had the low-grade fever, I have this lack of mental clarity. All of that stuff they can actually see and realize that it's not just them that's having the concern. It's actually something that happens to folks post-vaccine. Anyway, this is what I'm trying to do. If you like what I'm trying to accomplish with this, go ahead and hit that like button if you can for us, and I'll try to update you every couple of days in terms of when I learn things, understand things, to discuss them with you. I will do so. And again, this is not against the vaccine. This is not for the vaccine. Just sort of getting information out there in terms of what's happened to some people post-vaccine that they did not realize prior to the vaccination process. Anyway, thanks for listening again. Dr. Walker, stay well.